Hello, good morning, everyone. Yes, you start. Today, you and me talk only.
Okay, very good. So, as most of you know, my name is B. Coleman. I am not a homeopath. I am a lover of all things concerning natural medicine. And today we are discussing liver issues. So, the first thing on the agenda for me is by Joette Calabrese, and it is Gilbert's syndrome. This is a mild disorder in which the liver does not properly process bilirubin. It is, by the way, the same protocol for liver disease, so says Joette Calabrese. And you're going to see these two remedies quite a bit here. Chelidonium 6C, twice a day. Cardus marianus in mother tincture, twice a day. These are taken separately. The next is the Banerjee protocol for hepatitis A, B, and C. And I know we covered fatty liver earlier, but this would also be the same protocol for a fatty liver, both alcoholic and non-alcoholic. Also for chronic viral hepatitis and drug and toxin-induced liver disease. So there are two line protocols. The first line protocol is that you alternate the following two remedies every 3 waking hours. And it is Chelidonium majus 6X and Cardus marianus in mother tincture, again, alternated every 3 hours. The next part of that first line protocol, but separately, is sulfur 30C once a week, and this may help the rapid return to normal life. The third part of the first line protocol is Thuja occidentalis 30C. This is taken twice a day. Now, this will help clear up hepatitis B and C. The Thuja will help clear up hepatitis B and C. So no need to use it if what you have is hepatitis A. The second line protocol, Banerjee protocol, is you alternate the following two remedies every 3 waking hours again. Myrica, Myrica, mother tincture, and Chelidonium majus 6X. So you alternate those every 3 waking hours. The second part of the second line protocol is Nux vomica 30C once a day. And this is a particular help actually for alcoholics. And the third part of the second line protocol is again Thuja occidentalis 30C twice a day. The fourth part of the second line protocol is Calcarea arsenicum 30C. So that's Calcarea arsenicum 30C twice a day. The next is the Banerjee protocol for cirrhosis of the liver. Okay. So the first line protocol for cirrhosis of the liver is that you alternate these two remedies every 3 waking hours. Lycoclav 30C and Chelidonium majus 6X. Alternate every 3 hours. The second line protocol for cirrhosis of the liver is that you alternate the following two remedies every 3 waking hours as well. Lycopodium clav 30C, Chelidonium majus 6X. And that's the same as the first line, but now you add the following, and that is Myrica, M-Y-R-I-C-A, in mother tincture 3 times a day. So the second line protocol is basically the same as the first, but you add the Myrica mother tincture 3 times a day. The third line protocol is going to be the same up to this point. So alternate Lycoclav and Caledonia Magus 6X every 3 waking hours. The Myrica, again, mother tincture 3 times a day. And now it says, if ascites, A-S-C-I-T-E-S, persist through the first and second line protocols, then add acetic acid, mother tincture, 3 times a day. Now, only in the event of vomiting blood, you would add phosphorus 6C after each vomiting incident. Next, we have the Banerjee protocol for liver cancer. First line protocol, you are going to alternate the following 2 remedies every 3 waking hours. This is liver cancer. Hydrastis can in mother tincture and Caledonia Magus 6X. Again, alternate those 2 every 3 waking hours. The other part of it is Conium Mac 3C twice a day. And that is a first line protocol for liver cancer. The second line protocol for liver cancer, you would alternate the following 2 remedies every 3 waking hours. Hydrastis can in mother tincture, but this time it's alternated with Myrica cerifera in mother tincture. C-E-R-I-F-E-R-A. The second part of the second line protocol is Cardus marianus in mother tincture. And you do that twice a day. If in the event of acute pain, you would alternate the Cardus marianus mother tincture with belladonna 3C and do that every 10 minutes. Once you are no longer acute, you can resume with only the Cardus marianus mother tincture twice a day. And then the last thing I have is, again, one of the Requig drops, R7, called liver and gallbladder drops. You can purchase this, or you can make it if you have a remedy maker. The rate is a 10, not a 1 and a 0. It's a 10. The next is 2, 3, 5, 6. And when you take it, you take 10 to 15 drops in water 3 times a day before meals. If you're not getting results with this or not enough results, you can increase to 4 to 6 times a day after maybe 8 to 14 days. The indications for the liver and gallbladder formula is abnormal diseased liver, gallstones, pain without gallstones, hepatitis, swelling of the abdomen, flatulence, constipation, a weariness after meals, and irritation. So that is everything that I have. Does anybody have any questions? If there are no questions, then Dr. Imran, you can go. Eleanor, would you turn off your mic, please? And Suzanne as well. Thank you. Dr. Imran, are you on? I think he may have stepped away. Dr. Imran?
I had a question.
Sure.
I'm not sure if it's showing up in the chat, but the last thing that you just said, I missed part of it. Could you repeat it?
On the Requig?
I think it was on the Requig and what it treated. You listed a bunch of symptoms right after it, and I wasn't sure if those were connected to the Requig or
Yes, yes, they are connected. Would you like for me to repeat them?
please.
It's for abnormal or diseased liver, gallstones, pain without gallstones, hepatitis, swelling of the abdomen, flatulence, constipation, weariness after meals, irritation, and that would be it.
And what was the name of the Requig remedy?
It is the R7 is the number for it, and it is the liver and gallbladder drops.
Thank you.
You're welcome. Dr. Imran, are you back with us? I wonder if he's having internet problems. Huh. There's a little symbol next to his name with a red dot that is blinking. Does anyone know what that means?
Recording.
Ah, okay. Well, that isn't a problem.
For that rep with R7, is that in a mother tincture?
You know, I don't know. I would have to look that up. I suspect it is not. Most of their formulations are made up. Hold on, let me see real quick. I want to see if okay, so what it says the main ingredients are, it doesn't give potencies, but there's cardamom in there, chelidonium, cholesterinum. None of those are surprising. Colocynthus, lycopodium, and nux vomica. If you're interested in knowing the rates, I'm sure I can't find them for you. Message me and I'll let you know if you want to make that with your machine. With a lot of these remedies, I find that they have so many different ones that for my time at least, it's just faster if I order a small bottle of this thing and then just start making copies of it. But
Okay,
yeah,
thank you. Do you also have a place you can order from? I'm a little weary about ordering from Amazon.
I tend to order almost all my, well, Requit, I don't know if you can find on Helios. I tend to just go online and find those. I don't remember what the label, the brand is, but it's usually the ones with the red bottles. And for those, you're basically, most of those, my experience anyway, has been that I get them, they end up coming from India. I do find that they're very good though, the remedies, whether they're Requig or not. I do find that the remedies from India do tend to be very good. I haven't found a bad one yet.
Oh, okay, thank you. I did order some of the Requig. I believe it was from India. I don't remember the name of the site, but it had like pin markings on it, and so I was a little wary about ordering from them again.
Oh, really? Somebody wrote on it?
Yeah,
I've never had one arrive like that.
yeah, it was a Sharpie, and
Well,
I just wasn't
there's
sure if I'm hesitant to use it.
there's different people that sell out of India. If you note who that seller was, just don't buy from that particular one again. I've not had that happen to me either.
Thank you.
You're welcome.
I just saw a note that said Dr. Imran had, I don't know what if it said uploaded or downloaded a file. I'm wondering if he's trying to show us what he was going to say. I can't find it on the,
Okay.
it doesn't show up again.
Huh? He downloaded a picture of the Requig stuff in the
Ah.
chat.
Okay.
Okay. All right.
So Dr. Imran, can you hear us? Yes, there I see it.
Yes.
There you are. Go ahead, sir.
Okay, thank you. Bismillah Rahman Rahim. Good afternoon, everyone. Here is Dr. Imran from Pakistan. Today we are talk about a liver topic. So first I talk about some homeopathic remedies which we are common use fatty liver. First remedy is chelidonium. Chelidonium for fatty liver with pain in right upper abdomen. Chelidonium.
The
So I request
person, hold on, Dr. Imran. Someone named iPhone. You need to turn your mic off, please. iPhone. Please turn your mic off.
Thank you. So first remedy is chelidonium. Chelidonium is top remedy for fatty liver treatment. The marked symptoms for using this remedy in pain in right upper abdomen and pain under right shoulder. There may also be an enlargement of liver. The person is usually constipated. The stool passes in the form of hard balls. A distant abdomen with nausea and vomiting is also experienced. The patient suffers from excessive weakness. In case of jaundice in a patient with fatty liver, to chelidonium is the best remedy. A hallmark symptom that adds weightage for selecting this remedy a desire for very hot drinks and hot foods. So we are commonly use this remedy in mother tincture, in 1x, in 2x, in 3x, chelidonium in 30C, chelidonium in 6C, and chelidonium in 30C, and chelidonium in 200C according to the patient condition. So always avoid self-medication. So next remedy is lycopodium. Next remedy is lycopodium. Lycopodium is a natural remedy for great help for treating fatty liver with gastric symptoms and acidity. The patient complains of distance or bloating of abdomen soon after eating anything. The abdomen feel full of gas, burning, bleaching is also experienced. Even eating a little causes fullness in the abdomen. The patient feels heaviness and pain in the right upper part of the abdomen. Usually the symptoms get worse towards the evening and unusual craving for sweets and hot drinks in, in excess may be present. So we are use lycopodium in 30C, lycopodium in 6C, lycopodium in 12C, and lycopodium 30C, lycopodium 200C, and 1M according to the patient condition. So third remedy is phosphorus. Third remedy is phosphorus for fatty liver with food coming up after eating. Phosphorus is the best natural remedy for patient of fatty liver who feels as if the food is coming upwards after eating. This is accompanied by sore, also occur in a few cases along with pain in liver. The stools and flutters are very offensive. The patient feel weak after passing stool. The craving of particular things in diet is an important indication for using the medicine in fatty liver patients. These things include ice creams, cold drinks, and refreshing items like juices. So we are use phosphorus in 30C and phosphorus 200C according to the patient condition. So next remedy is Calcarea carb. Next remedy is Calcarea carb. Calcarea carb is a natural remedy for mainly fatty liver patients. The person is fatty, flabby with excessive fat in liver and whole abdomen. This remedy successfully helps in burning excess fat in liver. The digestion is very slow in such persons with long standing constipation. The abdomen always remains distant. Milk is also suitable for these persons. A few constitutional symptoms that are taken note of is a desire of boiled eggs or strange things like chalk and pencils. Another is sensitivity to cold air and excessive sweating on the head. So we are use Calcarea carb in 3x, Calcarea carb 3C, Calcarea carb 6C, Calcarea carb 30C, Calcarea carb 30C, Calcarea carb 200C, and Calcarea carb 1M according to the patient condition. Next remedy is Nux vomica. Nux vomica for fatty liver with pain in abdomen after eating. Nux vomica is the best fatty liver treatment in homeopathy when the cause is over a cause of alcohol. It is suggest when pain in abdomen begins or few hours after eating with a feeling of stone in abdomen, sore or bitter bleaching accompanies in the pain. A very significant symptoms for selecting Nuxomica for fatty liver is constipation with an urge, urge to pass stool or poop. The stool, however, is insufficient and unsatisfactory. The passing out of stool summarily from the pain in the abdomen. So we are use Nuxomica in 6C and in 12C and 30C and 200C according to the patient condition. So next remedy is Berberus vulgaris, is the most suggested remedy for gallstone, sharp pain in the region of the gallbladder are treated with the Berberus vulgaris. So next I talk about some remedies which we are common use for hepatitis. Hepatitis is the one of the most common liver problems involving of the liver. It is mainly caused by viral infections and is characterized by the presence of the inflammatory cells in the liver tissue. Top grade remedies for hepatitis are chelidonium, arsenic album, and phosphorus. Chelidonium is very effective in treating an enlarged liver with tenderness, dull, throbbing pain in the region of the liver is also best treated with medicine chelidonium, where hepatitis result from bad food or food poisoning. So we are use chelidonium for liver 6C, chelidonium 6C, chelidonium 12C, and 30C and 200C according to the patient condition. So next remedy is arsenic album is the best remedy for liver problem like hepatitis. The symptoms to look out of arsenic album is burning pain in the liver which gets better with warm drinks. So we are use arsenic album in 30C and arsenic album in 200C according to the patient condition. Phosphorus is another very frequently remedy for both acute and chronic hepatitis. So we are use this remedy in phosphorus in 30C and phosphorus in 200C according to the patient condition. So next remedy is Cardus miranus, Cardus mar. Liver cirrhosis is a condition in which the normal working of the liver is majority affected due to long-term damage. It is mainly characterized by the replacement of the normal liver tissue by scar tissue. The most effective remedy for liver problems such as cirrhosis or Cardamom is effective remedy for liver cirrhosis with general edema, a liver that is swollen literally, a condition that gets rose from pressure is treated well with Cardamom. So we are use Cardamom in murder tincture and Cardamom in 1x, Cardamom in 33C and 6C and 30C according to the patient condition. So I see in my clinical practice, Cardus are giving a best result only in murder tincture and 1x, 2x, and 3x. So next remedy is phosphorus. Phosphorus is also very helpful in cirrhosis of the liver. A congested liver with weakness and sensitivity are treated well with remedy phosphorus. Put it on the list of top remedies for liver problems. So I use phosphorus only in 30C and 200C according to the patient condition. So next remedy is picric acid. So picric acid we are used for liver problems such as a fatty liver. Fatty liver also known as the fatty liver disease in a element in which large amount of at accumulate abnormality within the liver cells. It mainly occurs in person who have excessive alcohol intake or who are obese. Picric acid giving a remarkable result for liver damage. So we are use this remedy picric acid in 30C and picric acid in 200C according to the patient condition. So next remedy is arsenic album. Arsenic album for liver cirrhosis with fatigue and weight loss. Arsenic album is one of great help for patient of liver cirrhosis who experience fatigue as the main symptoms. The patient feel totally exhausted from doing a little labor. He or she gets on losing weight due to debilitating effect of cirrhosis of the liver. Arsenic album is also the remedy for vomiting of blood along with vomiting, burning in abdomen, fever poisoning towards to use of arsenic album, vomiting follows drinking and eating, the liver region feels painful, ascites or fluid in abdomen can also be deal with remedy arsenic album. For the general symptom of fatigue and burning in abdomen shoulder match to a general relief from taking warm drink may be gathered by patient in addition to the above symptoms. If the mental picture is to be considered, the symptoms that assume top position are anxiety, restlessness, and fear of death. So I use arsenic album in 30C, arsenic album in 200C, and arsenic album in 1 m according to the patient condition. So fourth remedy is Nux vomica for liver cirrhosis patient with long-term alcohol abuse. So Nux vomica is a natural remedy of great help for patients of liver cirrhosis who have a history of long-term alcoholic abuse. Such patients usually also have been suffers of chronic acidity and constipation. The acidity symptoms including heaviness in abdomen and burning in abdomen a few hours after meals. The constipation is marked by snatty, insufficient stool or pop, but with the constant urge to pass stool, Naxumica can help to decrease soreness on pay or pain in liver region. The pain may present itself as thickening in character. The patients needing remedy, Naxumica usually have an inclination to take highly spicy diet, stimulate like coffee and alcoholic drink and fat. The constitutional symptoms that need to be mentioned are mentally angersome and irritable nature, being sensitive to external impressions like noise and odor, and also a sensitivity to cold air. So we are use Nux vomica in 12C, Nux vomica in 30C, Nux vomica in 200C, Nux vomica in 1 m according to the patient condition. So fifth remedy is phosphorus for cirrhosis of liver with jaundice. Phosphorus is a beneficial remedy for treating jaundice in patients with cirrhosis of liver. The symptoms during jaundice are yellow appearance of skin and passage of stool of very offensive nature. Outmost weakness follows the passage of stool. The second spare where phosphorus is remedy of great help in vomiting of blood. Phosphorus has an excellent effect in controlling the blood appearing in vomiting. Apart from these symptoms, the desire for cold drink, juices, and ice cream is usually present in patient needing phosphorus. So we are use phosphorus in 30C and phosphorus in 200C according to the patient condition. So next I talk about some remedies which we are used for jaundice in cirrhosis liver. First remedy is chelidonium, is pain in liver under the right shoulder blade with jaundice symptoms. The jaundice symptoms include yellow skin, yellow urine, and yellow or white colored stool and yellow coated tongue. Desire for extremely hot drinks is noted in patient needing chelidonium. So we are use chelidonium for jaundice in cirrhosis liver, chelidonium in 3C, chelidonium in 6C, and chelidonium in mother tincture. So next remedy, phosphorus is of great help when the stool of very offensive nature is passed along with appearance of yellow skin on in contrast to chelidonium patient needing phosphorus have a desire for cold drinks. So we are used phosphorus in 30C and 200C. And Cardus miranus offer the natural treatment when jaundice with bright yellow stool, liver pain, and fluid retention in abdomen is experienced by a patient of liver cirrhosis. So we are used Cardus miranus in Mertenture, in 1X, in 3C, and in 6C. So next, I talk some remedies which we are used for blood vomiting in cirrhosis of liver. The vomiting of blood is a result of various in the esophagus. Phosphorus is the natural remedy when the vomits contain bright red blood. Desire of cold drinks may be present when the blood is dark colored, like blackish or coffee color, like so we are use this our remedy is phosphorus. So phosphorus we are used in 30C and in 200C according to the patient condition. So next for loss of appetite in cirrhosis of liver. Lycopodium is very beneficial remedy for patient of liver cirrhosis who have a diminished appetite. The patient needing lycopodium feels full on eating even a small quantity of food, heaviness, and distension of abdomen arise from eating a small quantity of food. Here, lycopodium can needing feels full on eating even a small quantity of food. Heaviness and distension of abdomen arise from eating a small quantity of food. Here, lycopodium can help in improving the appetite and turns up the digestive function. The patients needing lycopodium usually suffer from gas in abdomen. So we are use lycopodium in 30C and lycopodium in 200C according to the patient condition. So now I want to share some protocol which we are commonly use in our clinical practice. So first protocol is for jaundice. First protocol is for jaundice. So first remedy is cordus mar in mother tincture, bryonia in 200C, and sulfur in 30C. Bryonia 200, cordus mar in mother tincture 10 drops 3 times a day. Bryonia 200C once a day, and sulfur 30C 3 times a day. So next protocol for fatty liver, which we are commonly use in our clinical practice. Cordus mar in mother tincture, colostrinum in 30C, and phosphorus in 30C. Cordus mar 10 drops 3 times a day, and colostrinum 30C 2 pellets 3 times a day, and phosphorus 30C 2 pellets 3 times a day. So next protocol I want to share for cirrhosis of liver. First remedy is cordus mar in mother tincture, chelidonium in mother tincture, and cyanothus in mother tincture, And fourth remedy is Chunanthus in Mertenture.
Would you spell the last two remedies, please?
Mix together these four remedies equally quantity and use 10 drops 3 times a day in half cup of water before half hour meal. So next I want to share a protocol for liver cancer. First remedy is Cardosmar in Mertenture, Myrica, in Mertenture, and Bryonia in 200C. So Cardosmar in Mertenture 10 drops 3 times a day, and Myrica in Mertenture 10 drops 3 times a day separately, and Bryonia 200C 2 pellets twice a day. So anyone have a question about this topic? So I am here to answer.
Do you have something to treat liver cysts?
Okay, so I share a protocol. First remedy is Chelidonium in 6C, Bryonia in 200C, and sulfur in 30C. Bryunia 200C twice a day, sulfur 30C 3 times a day, and chelidonium 6C 3 times a day.
Any idea how long you should expect to take that?
First need to take a 3-month regular. After that, go for abdominal scan and see the condition of a size of cyst.
Thank you.
You're welcome.
Could you give the potencies for berberis for gallstones with sharp pain, please?
Berberus in 230C or 200C.
Thank you.
You're always welcome.
There is also in the additional protocols book for liver cysts. The protocol for that is Conium Mac 3C twice a day and Hydrastis mother tincture 5 drops in water twice a day.
And in liver issues like cyst or liver cancer or hepatitis, so we need to find a miasmatic remedy and talk about family diseases. If have cancer in history or other miasm in history, then we need to add some nosode.
How long does the berberis take to work on gallstones?
Berberus only we are used for a painkiller, but other remedies for gallstone like cardamom, colostrinum, lycopodium, natrum sulf. These are remedies we are used for gallstones. Lycopodium, natrum sulf, colostrinum, chelidonium, cardamom, and berberus we are used for pain.
Dr. Imran, please, what would you recommend for an 80-year-old lady who has fatty liver and high cholesterol? Thank you.
And what about blood pressure?
Yes, and high blood pressure too.
Okay, so first remedy is Crataegus oxy and Allium stava in myrrh tincture and Crataegus in myrrh tincture mixed together these two myrrh tincture and use 10 drops 3 times a day in half cup of water before half-hour meal. And next, colostrinum 30C, colostrinum 30C, 2 pellets 3 times a day. and cardamom in mother tincture, 10 drops 3 times a day in half cup of water before half-hour meal. Avoid all type of spicy food, fast food and oily food. Give her a simple and boiled food, steam foods or air fryer foods.
Okay, thank you. And I have another question regarding constipation, chronic constipation. Is it only related to gut issues or is it also related to liver issues?
Both, also intestine issues, dryness in intestines,
Excuse me, dryness in what?
intestine issues.
Spleen?
Okay, just a minute, I write. So anyone have another question? So I want to say thanks to everyone. Next Sunday, we meet again, same time, with new topic. And thanks again, and God bless you all.
Thank you, Dr. Imram, and God bless you.
Thank you.
Can we use the same link for next week?
We are share a different link and we post in groups our next topic, but time is same, topic is different, and we send a link again.